5 tours of duty in Iraq and Afghanistan left 35-year-old Army Specialist Scott McDonald with chronic back pain. His wife Heather says over the course of a year, VA doctors in Columbus, Ohio, prescribed him 8 pain and psychiatric medications.
It just got out of control. They just started pill after pill, prescription after prescription.
Wait, he would go for follow-up visits?
And he'd come home with all brand new medications, higher milligrams.
Then, a VA doctor added a 9th pill, a narcotic called Percocet. Later that evening, Heather came home from work and found Scott disoriented on the couch.
I asked him, "You didn't by any chance by accident take too many pills, did you?" And he's like, no, I took what they told me to take, Heather. And I propped a pillow under his head, and that's how I found him the next morning, exactly like that.
He wasn't breathing. The coroner ruled McDonald's death accidental. He had been, quote, over-medicated and died from the combined effects of 5 of his medications.
There's an overuse of narcotics. It's the first reflex for pain.
Dr. Phyllis Hollenbeck, currently a physician with the Jackson, Mississippi VA, raised her concerns with the federal government about the VA's practices for prescribing narcotics.
The people in charge said, "We want you to sign off on narcotic prescriptions on patients you don't see." I was absolutely stunned, and I knew immediately it was illegal. It works on the surface. It keeps the veterans happy. They don't complain. They're not coming in as often if they have their pain medicine. And the people in charge don't care if it's done right.
We obtained VA data through a records request, which showed the number of prescriptions written by VA doctors and nurse practitioners during the past 11 years. The number of patients treated by the VA is up 29%, but narcotics prescriptions are up 259%. A dozen VA physicians who've worked at 15 VA medical centers told us they've felt pressured by administrators to prescribe narcotics and that patients are not being properly monitored.
I have seen people that have not had an exam of that body part that they're complaining of pain in for 2 years. It's easier to write a prescription for narcotics and just move along, get to the next patient.
This doctor, who presently treats pain patients at the VA, asked not to be identified.
We're letting people come in and prescribing massive doses of narcotics, and they also are on drugs for mental health problems.
If you're giving those kinds of quantities of pills, I assume that requires a rather close eye being kept on the patient.
You would think so, but it isn't the case.
We gathered data from 5 of the states with the most veterans. We found veterans are dying of accidental narcotic overdoses at a 33% higher rate than non-veterans. Dr. Robert Kearns is the Director of Pain Management for the VA nationwide.
So we're faced in this country with an important health crisis that we're talking about today related to prescription drug abuse. But we have a similar crisis related to chronic pain and the way that it's managed in this country.
Kearns says VA is taking action to ensure both patients and providers are aware of the risks and benefits of narcotics.
Providers are trained to have a thoughtful discussion with their patient, to share concerns about the limited potential benefit of these medications, but also these risks that we're talking about today.
Heather McDonald says she plans to sue the VA.
He never should have been taking those many pills, but he trusted his doctors. My husband served honorably, with pride and dignity, not to come home and die on the couch.
Now, Jim, the VA declined to talk with you about the McDonald case or any of the specifics in your story, but what else did the VA have to say in its own defense today?
Well, Dr. Robert Kearns, the Director of Pain Management for the VA, who we just heard from, had a couple of points he wanted to make. The first is that while narcotics, opioids, like Percocet, are not a last resort, they're not the first-line treatment option either. And that secondly, if you look at the statistics, the number of veterans with chronic pain being treated with opioid therapy is relatively small.
Jim Axelrod, thank you very much, Jim.